day. Today our group will be demonstrating a respiratory exam on Mr. Gqobo.
Now we will demonstrate good hand hygiene. And how we will do that is by rubbing our palms together after having folded with a handful of hand sanitizer. Then thereafter, we will interlace our one hand on the other. And then one hand you do to the other. Then thereafter, you'll interlace your fingers. And then thereafter, you will interlock your fingers, your hands to the opposite directions. And then you change positions. And then you will wrap your thumbs. And you wrap your other thumb. Then you rub your palm. And you do to the other. And you're done.
Hello, I'm Lisa and I will be doing the landmarks that are of importance for a respiratory exam. Anteriorly, the landmarks that are important are your supraclavicular fossa, your suprasternal notch, your sternocleidomastoid muscle, which is also on the other side. And then moving down, you feel your angle of Louis, which on Scully over here is the joint between your manubrium and your sternal body. To either side of your angle of Louis, the second intercostal space can be found. And further down, your xiphoid process can be found, which on Scully over here is this projection over here. Posteriorly, landmarks that are of importance is your spine, and particularly your C7 vertebra, as well as your scapulas. For the anatomical lines, we look for the mid-clavicular line, which lies in the middle of your clavicle, which runs right down, as well as your anterior axillary line, your mid-axillary line, as well as your posterior axillary line.
Nkavelo Shivambu, and this is Tatenda Potera, and we're just going to do a general examination on you today, if that's okay, sir.
Alright. Greetings, Mr. Gqobo. First of all, I'm just going to check that the bed is at a 45-degree angle. We've got good lighting and the patient is exposed from the waist up. So, sir, have you ever had any previous lung examinations or procedures done on you?
No.
Okay, well, to begin with, I just want to check for wasting. Alright. So what you'd normally find in wasting is prominent ribs, gaunt face, and flappy skin, but that doesn't seem to be there. I'd also like to check for jaundice. In patients with jaundice, you'd find discoloration, you'd find yellow pigmentation in the skin, in the fingers, and in the sclera as well, but that also seems to be okay.
Okay, so next we're going to check for anemia. Now, anemia is characterized by low hemoglobin concentration. Now, I'm going to look at your nail beds for any pallor, but your nail beds look fine. We can also check for the shape of the nail. In koilonychia, which is iron deficiency anemia, you have spoon-shaped nails, but you don't have those. And now I'm just going to check the conjunctiva to check that they're nice pink color, and they are. So that's fine.
Next, I'd like to check for clubbing. Clubbing is a chronic pulmonary suppuration, and you'd find symptoms such as empyema. Now, can you please put your fingers together for me, sir, in this shape here? Now, what you want to do is make that diamond shape with your fingers. This is called Shamrock sign. Alright. Can you do that with the other fingers as well? Alright. What you'd find in patients with clubbing is that you wouldn't see that diamond shape in between the two cuticles because of the increasing in skin fold at the cuticles.
Okay, Mr. Gqobo. So now we're going to check for cyanosis. So cyanosis is a blue discoloration in the skin of mucosa due to increased level of deoxygenated hemoglobin. We have peripheral cyanosis, which we can usually see in the hands and feet and lips, but you don't have that. And we also have central cyanosis, which we see in the tongue. Can you please stick out your tongue for me, Mr. Gqobo? And then can you move it to the left and to the right? So your tongue's a nice pink color, which shows that there's no sign of central cyanosis.
Right, and next we want to check for edema. So normally what you find in edema is the swelling of the patient's ankles, alright, but you don't have any of that. That would normally be caused by an excess accumulation of fluid, but it seems as though everything is normal here.
Okay, Mr. Gqobo, I'm going to ask you to sit up for me and face the other direction. So now we're going to check for lymphadenopathy, which is found in systemic illnesses. It's due to increased size of lymph nodes. Mr. Gqobo, I'm just going to touch around your neck if that's okay.
All right.
Okay, thank you. So we're going to start with the submental lymph nodes and then move to the submandibular lymph nodes and then move to the tonsillar lymph nodes, the preauricular lymph nodes, the postauricular lymph nodes, also checking the anterior cervical chain as well as the posterior cervical chain, the occipital lymph nodes, the supraclavicular fossa lymph nodes, as well as the axillary lymph nodes. You can rest your arm there. Seem fine. And that seems fine. So your lymph nodes seem fine, Mr. Gqobo.
Alright, Mr. Gqobo, now can I please get a nice big smile from you? Alright, and can I see your fingers? Now, what I was just checking for there, normally what you find in patients who smoke is yellow staining in the teeth and in the nails due to the nicotine, but you didn't have any of that.
I'm going to ask you to lift your hands up like this for me. And what I'm checking for here is any flapping tremors, which are significant in carbon dioxide retention, which is found in COPD. But you seem fine. You can put your hands down. Thank you.
I'm Mr. Gqobo. Today I'll be assessing your vital signs. The most important vital signs would be your breathing rate, your pulse rate, as well as your temperature. So when we take your pulse rate, we can measure it. We can take it from the radial pulse, the brachial, the carotid, the femoral, the dorsalis pedis, as well as the posterior tibialis. But for the sake of the assessment, we'll be taking the radial pulse. Your pulse rate seems to be completely normal, and it's about 72 beats per minute, and the range that it should fall in is between 60 and 100. When it falls above 100, that's known as tachycardia, when your heart beats too fast, and below 60 would be bradycardia, when it beats too slow. And then your breathing per minute is also fine, because it should be between 14 and 20 breaths per minute, and yours is 18, which is completely normal.
Good morning, sir. I'll be performing a respiratory inspection both anteriorly and posteriorly. We're going to start with any signs of respiratory distress, of which I don't see any. There are no signs of cyanosis, which would present with a bluish discoloration. Your breathing does not look laboured or forced. Your nostrils are not flared as you breathe. And I do not see any use of accessory muscles as you breathe. Next, we're going to be looking at the skin anteriorly. The skin looks normal and clear. I do not see any scars or lesions related to a respiratory operation. The hair distribution is normal and the skin colour is normal. Next, I'll be examining the shape of your chest. Okay, so your chest shape is normal, as it is twice as wide as it is deep. Now I'm going to be examining the symmetry. I'm now looking at middle lobe expansion. There's an equal rise and fall on both the left and right side, which indicates symmetry. I'll be looking at the upper lobe expansion next. There is an equal rise and fall on both the left and right side. Lastly, I'll be looking at the lower lobe expansion. There's an equal rise and fall, which indicates symmetry. Now I'll be examining your trachea. Over here we have the sternocleidoid mastoid muscle, and on the other side as well. This is the suprasternal notch. And the trachea falls centrally between the two clavicular heads. Next, I'll be examining the respiratory rate. As mentioned before, this patient's respiratory rate falls within the normal range of 14 to 20 breaths per minute. Now I'm going to be performing the inspection posteriorly, so if you'd like to turn around and put your legs on either side of the bed, please. Thank you. We're going to start by looking at the skin. The skin looks normal, there are no scars or lesions, the hair distribution is normal, and the skin colour is normal. Next, I'm going to be looking at the shape. The spine falls nice and centrally and is very straight. And then will you mind taking a deep breath in and out for me? There's equal rise and fall on both the left and right side, which indicates symmetry.
Good day, sir. I'll be palpating you today. The landmarks that I'll be using as your clavicle, which has your sternoclavicular joint, then the joint that's connected between your scapula and your clavicle, as well as your sternal notch, angle of Louis, and your xiphoid process. We'll also be looking at your sternocleidomastoid muscle. So first we'll be checking for your temperature, which is normal, and feeling for any tenderness which is not there. Then I'll be checking for the centrality of your trachea by placing my ring and index finger on your clavicle heads, feeling with my middle finger the rings of your trachea, and putting my finger between your trachea and your sternocleidomastoid muscle. Distance in between is the same, which means your trachea is centrally placed. I'll be checking for your chest expansion by placing my thumbs aligned with your xiphi sternum. I'll ask you to take 3 deep breaths through your mouth, please. The distance in between my thumbs is approximately 5 centimeters, which is within the normal range, which is 5 to 8 centimeters. By doing this, I'm checking for the depth and symmetry of your breathing, which is normal. Next, we'll be checking for your vocal fermeters, which I'll be doing by checking in the 3 zones of your chest, which is the upper, middle, and lower. So I'll be placing my palm, and we'll ask you to say the word 99.
99, 99, 99, 99, 99, 99.
We say the word 99 because it is a nasal word, and the vibrations that I felt are symmetrical and not increased. If they were increased, it would suggest implications, suggesting that you have a solid medium mass within your lungs, which you did not have. Palpating posteriorly, I'll be checking for the centrality of your spine, and it is central. I'll ask you to please cross your arms in front of you. And then, by doing this, I'm exposing more lung area and exposing the scapula. So I'll be checking for your vocal fermeters in the 3 zones of your lung, which is the upper, middle, and lower. So as I place my palm, I'll ask you to say the word 99.
99, 99, 99, 99, 99, 99.
Your vocal fermeters is normal. It's symmetrical and not increased, which shows that there will be no implications.
Good morning, sir. I'm Leah Nell, and I will be doing your anterior percussion today. So, percussion is a technique where you use your dominant hand to produce a sound on your non-dominant hand by tapping on the middle finger like this. So the purpose of percussion is either to confirm that there are no abnormalities in the lungs, or it can be indicative of an underlying problem. For example, if an area that should be resonant now produces a dull sound, it could mean that there is a pleural effusion or fluid on the lungs. So before I start the percussion, the landmarks that are of importance for percussion is your supraclavicular fossa, your clavicles, your sternal notch, and your sternal angle. And your sternal angle will indicate to you where the second intercostal space is on both the left and right side. Alright, so for percussion, I will start in the supraclavicular fossa. I'll always compare left to right. Resonant. Resonant. And for the clavicle, I will percuss directly. Resonant. Resonant. Now the sternal notch, I'll find my sternal angle and move to the second intercostal space. Resonant. Resonant. Third. Resonant. Resonant. Fourth. Resonant. Resonant. And now the fifth. And there you can hear dullness in the fifth intercostal space, as we are currently percussing over the liver. Fifth. As well as on this side, you can also hear dullness, as we are currently percussing over the apex of the heart. So now we'll move down to the sixth. It's resonant. Resonant. And now I will percuss laterally. Resonant. Resonant. And now the axilla. Resonant. And on the other side. Also resonant. So there were no abnormalities anteriorly, so my colleague Sia will now percuss posteriorly to check for your abnormalities.
Hi, Mr. Gqobo. My hands are already washed, and I will be percussing you posteriorly. So I will need you to please come up and face the other direction with your legs hanging from the sides of the bed, please. Okay, thank you very much. Okay, so I will start by percussing the apices of your lungs in your supraclavicular fossa. Okay, it's resonant. It's resonant. That is good. So now please, Mr. Gqobo, please hug yourself like this And please lean forward a little bit so that more of your lung surface can be exposed. Okay, so now I'm going to look for your C7, which is your 7th cervical vertebra, which is used as a landmark for posterior percussion. C7, resonant, 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 resonance. We should be careful when we do this not to percuss on the scapula itself, but instead go around it towards the axilla. Okay. It's resonant, resonant. Now laterally, resonant. There's a bit of dullness there. That's because your liver is situated there. Okay, now for your posterior axillary line. Resonant and resonant. So, Mr. Gqobo, your lungs are fairly healthy. This is because the sounds that were produced from the percussion sites are congruent to what is normal. Had we found dull sounds where they were not supposed to be, it could be an indication of consolidation, which could be malignancy or TB or abscess. If there was stony dullness, it means there's an accumulation of fluid in your lungs, which could be a consequence of pleural effusion or empyema. And if there was hyperresonance, that could have indicated pneumothorax. But luckily you don't have that, so I can say your lungs are very healthy. So now please get ready to be auscultated.
Good morning, sir. Today I will be auscultating the anterior thorax. So during auscultations, various sounds, vocal resonance, as well as added sounds are usually observed. So before we get started, is it okay if I mention a few landmarks?
Alright.
Okay. This is your supraclavicular fossa, your sternal notch, your sternal angle, your mid-axillary line, your anterior axillary line, and your posterior axillary line, and then the 3 zones of your lungs. Okay. So first I will listen to your chest for breath sounds. I will use my bell of the stethoscope on your clavicular fossa and the diaphragm on your 2nd to 6th intercostal space. Okay, so can you please take some deep breaths in and out through your mouth, and I'll alternate between left and right so that I can complete the 2 sides. Okay. In, in. Perfect. Okay, so now I will be doing the exact same thing, but this time as I place my stethoscope on your chest, can you please say the number 99 for me? This is so that I can assess your vocal resonance.
99, 99, 99, 99, 99, 99.
So your breathing is normal, as I mostly hear vesicular breathing, which is when the inspiratory phase is longer and louder than the expiratory phase with no gap in between. It is a soft and low-pitched sound and is usually heard over the lateral parts of the chest, unlike bronchial breathing, which is much harsher in sound. So your vocal fremitus is symmetrical. I heard no wheezing, no inspiratory stridors, and no coarse crackles. Thank you.
Hello, Mr. Gqobo. My name is Jonathan. I will be auscultating you posteriorly today. I please ask that you turn your back to me with one leg on each side of the bed in a semi-horse riding position. I will start by using the bell of the stethoscope on your supraclavicular fossa. Please breathe in and out through your mouth deeply while I'm busy. I will now continue the rest of my auscultation by using the diaphragm of the stethoscope. I please ask that you hold your hands out in front of you and cross them over. Please continue to breathe deeply in and out through your mouth while I'm busy. The reason why I asked him to move his hands in front of him and cross them over is to move the scapula out of the way to expose more lung surface. hear no abnormalities in your breathing so far, I would just like to do a vocal resonance and firmities test. Please ask you to say the word 99 as I auscultate each of the 3 areas of your lungs.
99, 99, 99, 99, 99, 99.
Thank you. I could detect no abnormalities with the vocal firmities test.
Based on my general examination with regards to Jackal, all of my systems were normal, and my vital signs were also normal. And moving further down to my respiratory examination, which consisted of inspection, palpation, percussion, and auscultation, that was also normal. So I'm a happy patient, and I am good to go.